Shatkin, and I have with me a patient here, Stuart from St. Louis, who's agreed to let us tape his procedure today. And Stuart came to us from his dentist in St. Louis, Missouri, because he had trouble wearing his full upper denture that he got recently, and was apparently not a candidate for conventional implants due to the bone problems he has. I want Stuart to tell his story to you.
Good morning. Well, Dr. Shatkin told my entire story to my esteem, but at any rate, I did come up from St. Louis for the weekend. It happens to be on a Saturday, and my local dentist, Dr. Gersten in St. Louis, suggested Dr. Shatkin because of the implant surgery that he was familiar with, and he thought that would be a perfect situation, that I would be a good candidate. So after speaking with Dr. Shatkin on the phone, I got a lot of confidence in his procedure and himself, and so I decided to come up here. My wife has joined me, and my experience basically was that my upper teeth were less than perfect, and decided to go to a university implant clinic that has a fine reputation. And after about 8 or 9 months of measuring and extracting and things of that nature, they ultimately told me that I really wasn't a good candidate. I was less than happy, and I went back to my dentist, and he suggested Dr. Shatkin. So that's primarily the entire story, and now I'm here for the procedure, and I guess you'll see my mouth for the next hour and a half or so. So I'll let Dr. Shatkin get on with his thing so I can get back to St. Louis.
All right, well, what Stuart failed to mention is the procedure we're going to be doing is called FIRST. It stands for Fabricated Implant Restoration and Surgical Technique. This is a technique that I have developed and patented in the United States, and it involves prefabrication of the permanent crown and bridge work in advance, so that the way we handled this is Stuart's dentist, Dr. Gersten, was kind enough to forward us impressions and models of his teeth and x-rays, and this was all treatment planned in a laboratory, in FIRST laboratory. And the way it worked is myself and my father, Samuel Shatkin, DDS MD, reviewed the case. We did the surgery on the models. We fabricated a pre-surgical stent, which I'll show you, which is here, which has titanium sleeves in the stent. And then what we also fabricate is the finished crown and bridge work, which is right here. And so by using the surgical stent as a guide for placing the implants, and the finished crown and bridge work, which has been fitted to the model on the implants that were done in the laboratory, this can all be accomplished in one visit. Is that pretty good?
Feels fine.
Okay. Do a nice smile for the camera here, Stuart. It's now 11:10, 10 after 11. We started this procedure at 10 o'clock. In an hour and 10 minutes, we've successfully placed 10 implants and cemented Stuart's entire fixed bridge. And you can pick your head up a little bit now. And you can see the inside, how nicely the porcelain goes right up to the gum line and seals very nicely, but allows enough space for cleansability and irrigation. Now what I'm going to do now, just to be sure it's flossable, I'm just going to take this tip of the Explorer and just go in between each tooth and make sure that we're able to get the instrument through, which we are, at each location. There may be a little bit of cement at occasional spots where cement will be released. And he'll be able to put a floss threader through there. The other thing that we'll do for Stuart is give him this irrigating unit. This particular one is made by Interplaque. We recommend that you supply your patients with an irrigating unit, and this will help them to keep it clean as well at home. So that's a gift to you, sir.
Thank
You'll
you so
use that at
much.
home.
10 upper implants and the permanent fixed bridge cemented in place. And Stuart is a very happy person now. He's got permanent teeth. Not quite what God provided him initially, but as close as we can possibly get.